One of the things that I'm actually coming back to, because I'm hearing you talk about these cases where real people, you get their voice. In this scenario, it's obviously relationship counseling, but it could be with individual as well. And
Mm.
you get their voice and it conflicts with what you might have assumed
Yes.
was the case. Either they, don't think the therapy is as helpful, or they're not feeling as well as you think. And
Yeah.
it makes me think of the are a lot of therapists out there, and I was one of these as well. I'll just call it prior to FID, where I thought I could pick up someone who's deteriorating my care like
Yeah.
that. I probably
Yes.
never thought about what percentage of the time I would pick it
Yeah.
up. But what was so humbling for me when I did the FIT training with the International Centre for Clinical Excellence is actually we only pick it up, I hope I'm not butchering the numbers, less than 5% of the time,
Yeah. It's
a deteriorating
minimal.
case.
Yeah.
It's so small. And my outcomes or Novopsych or Fit Outcomes
Good
or
outcomes. Yeah.
any of those platforms, they can pick this up like 80% of the time,
Yeah. Yeah.
right? And
Yeah.
so to me, I just think in some ways it's a bit of a superpower if you are okay with being surprised.
Right.
And,
Yeah.
and I guess that's the key, right? If
Yes.
you're okay with being, oh, that's not what I thought.
Yeah.
And
Right.
so I'd love to hear from you about maybe how do you keep that curiosity open? How do you maybe even put your ego to the side at times to be open, surprised, and feeling good about being wrong at sometimes with your own assumptions.
Right. Well, I just remind myself we're all wrong at times,
Yeah.
so often what we pick up or think that we pick up and intuit is wrong, you know?
Mm,
I mean, really, it is. People, I can't remember who told me this, but people have been doing, our clients have been doing what they're doing for many years before we meet them. So we
mm,
don't have the abilities, I think, to really understand a client just from how they're presenting. So
mm,
it's kind of like I think what you said is great. The superpower, the fit measurements gives us the ability for them to score themselves and how they're feeling in these four areas in their life, and to actually use that as a springboard for talking about, tell me more about that, why isn't this getting better since last time? What's your understanding about that? So it's really about their voice. It's not me.
mm,
I don't have the superpower to understand what's going on,
mm,
excuse me, in their life. And the same with the alliance. I might think, well, this is, it's felt easy for me. It's like they've laughed and they smiled, and, I was able to help them, emotionally regulate when they were dysregulated. And I'm thinking, okay, that's gone well. And then they mark me low on the SRS, and I go, oh. Tell me about
mm,
that. What was a point there that, could have been done differently, or what happened there? Or, if it was a five on being heard, was there a point where it was actually worse? Was there a point where it was four? So it's
mm,
really teaching, I think the numbers teaching us humility, just keeping us on track that we're not it for the client or the clients that we see. They're the experts in their life. So,
mm.
yeah.
Thank you, Vivian. Wonderful.